And I have the pleasure now to introduce Peter Chojnowski, who's going to talk about identification. He's talking about Sister Lucia dos Santos of Fatima. And he has a bachelor's degree in political science and philosophy from Christendom College in Fort Worth, Virginia, and a PhD in philosophy from Fordham University in the Bronx, New York. He specializes in the philosophy of Thomas Aquinas, Catholic social thought, and has taught in various institutions of higher learning for the past 30 years, including Fordham University and Fairfield University, and many others, but they're two Jesuit institutions, so I like them. Currently, he teaches at the Immaculate Conception Academy in Post Falls, Idaho. Dr. Chojnowski's written two books and over 300 articles and reviews for various publications, including the British Catholic Medical Journal, Catholic Family News, the Latin Mass Magazine, the Journal of Metaphysics, and the Fatima Crusader. In November of 2017, Dr. Chojnowski established the Sister Lucy Truth Incorporated in order to investigate the life and identity of Sister Lucia dos Santos of Fatima. With nothing further,
all right, thank you. I would like to thank David Corey for inviting me here to address you this afternoon, and Dr. Jeff Beery for all that he has done to make this meeting possible. As you heard, my name is Peter Chojnowski. I have been an academic and a teacher for 37 years, and I've taught philosophy, logic, and ethics at 7 universities and colleges, along with teaching history, philosophy, logic, literature at 2 secondary schools. My PhD at Fordham is in the virtue theory of St. Thomas Aquinas. I have also, as is relevant to this discussion, been involved in researching and writing and lecturing about the apparitions at Fatima in 1917 for the past 25 years. It was this research and regular engagement with the topic of the events at Fatima, Portugal, from May to October 1917, which led me to take an interest in the life of Sister Lucia dos Santos of Fatima, the seer who outlived both of her 2 fellow seers who were also her cousins. The life of Sister Lucia, as she is called actually, or Sister Lucy, as I will refer to her, is according to the typical historical narrative a very straightforward one. Born in 1907 in the former Kingdom of Portugal, she was the youngest child of Antonio dos Santos and Maria Rosa Ferreira, both who were from the town of Alustro in Portugal. Though the family could be classified as peasants, they were not poor, owning land in the direction of Ortiga, Fatima, and the Cova de Iria. It will be the land in the Cova de Iria that will become central in the life of the young Lucia dos Santos. At the age of 6, Lucy received her first communion, and at 8 years of age, she was tending the family sheep, accompanied by her 2 cousins, Jacinta and Francisco Marto. A not particularly flattering account of the features of Lucy at this young age reads as follows. She was not a pretty child. The only attractions of her face, which was not on the whole repellent. That's sort of a terrible thing to say about a little child. So, were her two great black eyes, which gazed out from under thick eyebrows. Her hair, thick and dark, was parted in the center. Her nose was rather flat, her lips thick, and her mouth large. Between May and October 1917, when Lucy was 10 years old, she and her cousins, while tending sheep in the Cova de Iria near Fatima, reported visions of a luminous lady, who the apparition later informed them was the Virgin Mary. The apparitions to the three children would take place on the 13th of each month at noon from May until October. The only exception being August, when the children were detained by the hostile local administrator. That month, they did not report a vision of the lady until they were released from jail 2 days later. During the July apparition, the lady entrusted 3 secrets to the children. 2 of these were revealed in 1941 in a document written by Lucy. The famous 3rd secret was not written down by Lucy until October of 1943, when she fell ill with influenza and pleurisy. The same illness that her 2 cousins died of at the young ages of 9 and 10. The most famous moment during the Fatima apparitions was on October 13th, 1917, on which a miracle asked for by Lucy during the July apparitions took place. This was the famous miracle of the sun, witnessed by 70,000 witnesses and reported on by Portuguese secular media and even by the New York Times. Lucy's life after the apparitions was the life of a religious sister. After being educated in Porto between 1921 to 1925 by the Dorothean sisters, she entered this order of nuns as a postulant in October of 1925. Sister Lucy dos Santos' life as a religious can be summarized as follows. She returned to Portugal from her convent in Spain in 1946 to visit Fatima again. In 1948, she received special papal permission to enter the Carmelite convent of Coimbra, Portugal, where she is supposed to have resided until her death in 2005. During her life in the Carmelite convent, Lucy was expected to, and I quote, converse as little as possible with persons from without, even with her nearest relatives, unless their conversations be spiritual. And even then, they should be very seldom and as brief as possible. To this can be added that a Carmelite would only meet a visitor to the convent with her face half veiled, speaking through a heavy grate, and being surrounded by other nuns from her convent. These were the conditions even when she met with members of her own family. According to the typical historical and media narrative, Lucy gained the world stage by coming back to Fatima on the occasion of 4 papal pilgrimages, all on May 13th. first by Paul VI in 1967, and then by John Paul II in 1982, a pilgrimage he made in thanksgiving for surviving an assassination attempt the previous year. She also returned in 1991 to meet with John Paul II, and also in 2000 when her cousins Jacinta and Francisco were beatified. So what's the problem? Such is the life of Sister Lucia dos Santos of Fatima, or is it? Here are some of the photographs that first incited our concern and curiosity, made us question the official historical narrative of the life of Sister Lucia dos Santos. There's no sound on the initial pictures, so because I think it's important to just focus. I just want to have you take a close look and not run through it. In 1946, this is when she returned to Fatima to see her family and to revisit the shrine. 1946. Sun's fully on her face. These are two profiles. You see any problem? After viewing the pictures and the videos, which are supposed to extend through the whole life of Sister Lucy, we found that there was a problem that demanded a serious and scientific investigation into the evidence. In the 21st century, this evidence became readily available in the form of officially produced books on Sister Lucy and on the ready availability of images that could be gathered by their being posted on the internet. Also, extensive newspaper photos dating from her appearance with Paul VI at Fatima in 1967 were also taken into consideration. So what to do about this seeming lack of continuity between the appearance of Sister Lucy prior to, say, 1960 and Sister Lucy post-1960? Beginning in 2017, the 100th anniversary of the Fatima apparitions, Sister Lucy Truth, incorporated in the state of Washington as a tax-exempt nonprofit organization, collected hundreds of photos stretching from 1917 to 2005, dozens of videos, and thousands of pages of handwriting samples, along with letters ascribed to Sister Lucy from the mid-1950s to the early 1980s. Our purpose was to submit this evidence to relevant experts at the top of their professions to make the judgment from their own professional point of view whether there was a single individual appearing in pictures and videos from the years 1917 through 2005, or rather, were there multiple individuals being presented as Sister Lucy dos Santos of Fatima during these years? Now I would like to present to you, through a video and through my own presentation, some of the experts that we have consulted and the reports they have produced. Again, we asked them one question: is there one individual here, or is there more than one individual portrayed here? Here are some of the reports. The first one is Lois Gibson, one of the world's foremost forensic artists, who holds the 2017 Guinness World Record for the most identifications for a forensic artist. Ms. Gibson has helped Houston's police force solve 1,266 crimes with her forensic work. Gibson also attended dental school and constructed dentures at the University of Texas Health Service Center in San Antonio from 1977 to 1978. She provided Sister Lucy Truth with 3 separate comparison reports. 2 analyzed the question of 1 or 2 individuals, and the third deals with the question of whether there was more than one individual taking the place of the real Sister Lucy. Here is the summary of her findings.
1. The nasal bone of A is narrower than B. This causes the eyebrow hair growth to occur closer together in the horizontal center of the superciliary arch of A compared to the wider apart eyebrows of B. 2. The eyes are closer together due to 1. 3. The bottom third of the nose is narrower in A compared to B. The nostril holes of A are rounder, more visible when viewed frontally, and those holes are closer together on A than on B. The nasal holes of A are a different shape than the nasal holes of B. 4. A's philtrum, the distance from the bottom of the nose to the top edge of the top lip, is longer than B's philtrum. 5. The lips of A are narrower on the horizontal plane than B. The top lip of A is wider on the vertical plane than B's top lip. The bottom lip of A is thicker on the vertical plane and protrudes further forward beyond the horizontal indentation below the lips compared to B. Sister Lucy Truth consulted Lois Gibson, one of the world's foremost forensic artists who holds the 2017 Guinness World Record for most identifications by a forensic artist. She has helped Houston's police force solve 1,266 crimes with her forensic work. Mrs. Gibson has provided Sister Lucy Truth with 3 separate comparison reports that, from a forensic standpoint, conclusively indicate the existence of 2 separate Sister Lucys.
Let me just summarize some of her findings. And this is actually reading from some of her reports. In these reports, Gibson compares individual A, that is Sister Lucy prior to 1960, and Sister Lucy from 1967 through 2005. Now I will read from the report itself. This is her report. There is no perfect comparison between the same individual in separate photos. However, it is possible to know when the individuals in different photos are not the same. Due to the various completely different facial structures of individual A compared to B, it is impossible there are the same woman. Number one reason, the foreheads show much different underlying frontal bones. The superciliary arch of B protrudes forward much more than A. The noses are a different shape, with B having a larger, rounder, and more downward angled tip, which cannot be explained by cartilage growth. The philtrum, the distance from the bottom of the nose to the top edge of the top lip, is longer in A than B. The lips on A are thicker and narrower on the horizontal plane than B, with A's bottom lip protruding forward much more than B. Note, dentures, should they have been involved, would replicate the pre-existing dentition and thus not cause such a drastic difference. That's critical here. Dentures, I repeat, dentures, should they have been involved, would replicate the pre-existing dentition and thus not cause such a drastic difference. The horizontal mental indentation below the bottom lip is wider on the vertical plane on A and indents deeper below the bottom lip on A than on B. The mental protuberance of B projects forward to a drastic extent far different from the mental protuberance of A, which recedes below the bottom lip. She emphasizes this herself. There is no plastic surgery that could accomplish this, nor would it be offered or desired. Ms. Gibson emphasizes in her report that she has successfully reconstructed faces with only the skulls of unidentified murder victims and has written a textbook about this subject. The book is entitled Forensic Art Essentials.
A and B are shown at a much different age in this photo comparison. Even taking that age difference into consideration, the drastic lighting shows that B's mental protuberance of her mandible is larger and thrusts much farther forward from her facial plane than A. The aging process would cause the mandible to shrink, not grow larger. Said more simply, the chins of A and B have a drastically different shape. This drastic difference in the mandible area shows these cannot be the same individual. There is no plastic surgery that would make A's chin look like B's chin. Differences described in 1 through 5 in Our Lady of Fatima Nun Comparison 2 also hold true in the above individuals, even considering the large age difference and the presence of glasses on B.
So that was her judgment, that there's a different person involved in the pre-1960 and the post-1960. But for the sake of thoroughness and for an attempt to advance our investigation of what happened, we asked Gibson, now that she has identified that there was an imposter, to consider whether there was only one or multiple imposters during the span of years from 1967 to 2005. Her answer was that there was only one imposter appearing during the whole span of those years. So we're looking at pictures from 1967 going all the way to the final pictures in 2005.
Confirmation of only one Sister Lucy substitute. Sister Lucy Truth commissioned forensic expert Lois Gibson for a second report to confirm whether there were multiple imposters that replaced Sister Lucy of Fatima or only one imposter. She confirmed there was only one imposter from 1967 until her death in 2005. As explained in Our Lady of Fatima Nun Comparisons 1, 2, and 3, it appears the original nun was substituted years after her first appearance. Above I have the substitute nun shown A, at her youngest appearance. B and C are her, as she appeared older and oldest in that order. It is my expert opinion that the substitute nun is one and the same individual. Said differently, it appears the first nun was not the same woman who appeared above in later years, and was named as that same nun, meaning there was a substitution. However, there was never more than one nun substituted for the original nun attached to the miracle of Our Lady of Fatima.
Finally, we asked Ms. Gibson to give us age progression sketches of what the real Sister Lucy would look like at the ages of 60 and 80, in order to compare them with the pictures of Sister Lucy II as she appeared in 1967, when she was supposed to be 60 years of age, and in 1991, when she was supposed to be 84. What was she supposed to look like, and what did she actually look like? These are Lois Gibson's age progression sketches.
Below are renditions by Lois Gibson of what the real Sister Lucia may have looked like when at the ages of 60 and 80, respectively, based on the photographic evidence of the younger Lucia. On the left, post-1967. Sister Lucy as she appeared in 1967 at the age of 60. On the right, post-1967. Sister Lucy as she appeared in 1991 near the age of 84. On the left, forensic illustration of Sister Lucy at age 60. On the right, Sister Lucy II as she appeared in 1967 at the age of 60. On the left, forensic illustration of Sister Lucy at the age of 80. On the right, Sister Lucy II as she appeared in 1991 near the age of 84. It must be noted this writer has successfully reconstructed faces with only the skulls of unidentified murder victims and has written a textbook about this subject.
looking at those forensic sketches, we see that the actual photographs of Sister Lucy as she appeared in public during those years do not resemble the forensic sketches at all, which is important to note. Next, I move on to another expert that we commissioned, and I'll show you what his findings were. Sister Lucy Truth commissioned Dr. Joseph Mascaro, DMD, a well-respected oral surgeon with over 40 years of experience, to analyze our full photo and video collections of the two Sister Lucys and provide us with his expert opinion. Here is his report.
Oral Surgeon Report by Dr. Joseph Mascaro, DMD. There is no good explanation, except two different individuals. Sister Lucy Truth commissioned Dr. Joseph Mascaro, DMD, a well-respected oral surgeon with over 40 years of experience, to analyze our full photo and video collections of the two Sister Lucys, and provide us with his expert opinion. Dr. Mascaro points out that not only are the profiles of the two individuals in nearly opposite condition, but these differences cannot be explained through dental work, and are caused by different skeletal structures of the face. Because of this medical fact, Dr. Mascaro concludes, "It is my opinion that Lucy 1 and Lucy 2 are not, and cannot be the same individual." These opinions are offered to a reasonable degree of medical certainty. From Dr. Mascaro's Oral Surgeon Report. After reviewing the photographic and video evidence over the course of several months, it is clear that Lucy 1, subject AB, and Lucy 2, subject CD, are not the same individual. Several anatomical facts support this conclusion, particularly when the profiles are compared. Retrognathic versus prognathic profiles. Lucy 1's mouth, teeth, tend to extend anteriorly, forward. In other words, her mouth area sticks out relative to her other facial structures. This is an underlying feature of Lucy 1's skeletal structure. This skeletal structure would not significantly change if all of her teeth were extracted and dentures worn. In contrast, Lucy 2's profile presents a nearly opposite condition, a prognathic profile with a concave appearance. Lucy 2's presents maxilla, upper jaw, protrusion, and mandibular protrusion. This protrusion is observable as Lucy 2's mandible, chin, is nearly parallel to the tip of her nose, a spot anterior to her nostril. Yet, Lucy 1's chin is recessed relative to the tip of her nose. The most anterior part of Lucy 1's chin is vertically aligned to a spot posterior to her nostril. Tooth extraction and dentures. Skeletal structure would not significantly change if all of her teeth were extracted and dentures worn. Dentures, which seem to be at least reasonably well fit, further support the conclusion that these images depict two different people. The presence of dentures would work to maintain the vertical dimension and prevent over-rotation of the mandible. With the vertical height maintained, there is no good explanation regarding Lucy 2's significant chin protrusion forward when compared to Lucy 1. In addition, Lucy 2's facial height does not appear radically different than Lucy 1, which, again, supports the opinion that removal of all the teeth is unable to account for the marked change in profiles, particularly the mandibular protrusion. A skeletal, not dental, difference. A severely prognathic chin is skeletal, not dental in origin. Conclusion? During the course of my career, I have performed hundreds of jaw osteotomies, precisely planned fractures of the jaw to reposition the bones, and extracted thousands of teeth. I am familiar with expected changes to an individual's face as a result of tooth extraction and placement of dentures. It is my opinion that Lucy 1 and Lucy 2 are not, and cannot be the same individual. These opinions are offered to a reasonable degree of medical certainty.
So I'd just like to emphasize again a few things that Dr. Mascaro mentioned. He points out in his report that not only are the profiles of the two individuals in nearly opposite condition, but those differences cannot be explained through dental work and are caused by different skeletal structures of the face. Not even dentures can explain the differences, since, as Dr. Mascaro says in his report, it certainly appears that Sister Lucy too has full dentures, dentures which seem to be at least reasonably fitted, further support the conclusion that these images depict two different people. The presence of dentures would work to maintain the vertical dimension and prevent over-rotation of the mandible. With the vertical height maintained, there is no good explanation regarding Sister Lucy II's significant chin protrusion forward when compared to Lucy I. Dr. Mascaro again summarizes by saying, during the course of my career, I've performed hundreds of jaw osteotomies, or precisely planned fractures of the jaw to reposition the bones, and extracted thousands of teeth. I am familiar with the expected changes to an individual's face as a result of both tooth extraction and placement of dentures. It is my opinion that Lucy I, which is pre-1960 Sister Lucy, and Sister Lucy II, post-1960 Sister Lucy, are not and cannot be the same individual. These opinions are offered to a reasonable degree of medical certainty. The next expert that we consulted was Dr. Julio Garcia, who specializes in cosmetic and plastic surgery. In Dr. Garcia's report, he starts out with his background that would qualify him to make a judgment about the question of one or two Sister Lucys. Here is what he states. I am board certified in plastic surgery. I have served on the board of trustees of the Clark County Medical Society as former vice chief of staff at the Humana Sunrise Hospital and chief of plastic surgery at both Humana Sunrise and Valley Hospital. My educational background includes a degree in art history and biology from Northwestern University. I earned a medical degree from the University of Illinois at Chicago College of Medicine. Here are the findings of Dr. Garcia's report. Note here that subject B that Dr. Garcia is referring to is Sister Lucy prior to 1960, and subject C and D are post-1960 Sister Lucy. C being Sister Lucy from 1967, and D being Sister Lucy after 1967.
Finding number 1. Inconsistent chins, visibly different chins, unexplainable except the individuals are different, or a chin implant. Subject C and D, that's 1967 and after. Subjects C and D have far more prominent, protrusive chins when compared to the profile view of subject B on top, the real Sister Lucy. The difference cannot be explained by the aging process, nor can dental work account for the observed discrepancy. As we age, we lose fat and bone, making the appearance of the chin less prominent over time. The chin and jaw will not be altered in the manner apparent in the image and video with usual dental work. It would have to be a broken jawbone or broken facial bones. Side-by-side profile view, these are the photos that the plastic surgeon picked out. 2 Sister Lucy IIs on the bottom, and then the one Sister Lucy on the top. Now, I bet you never thought about eyelid creases. Look what he says. This is quoting from his report to us. It would be very unusual to not be able to detect a crease in the eyelid when an individual is young and then observe such a crease when that same individual ages. However, in images from the 1940s, it is nearly impossible to detect any crease in the upper eyelid. Yet in the post-1967 photos, the upper lid crease is observable in nearly every photograph. Here we go again. You see up there is the first one. Sister Lucy 2 is on the bottom. This is 1967 over there, and this is 1999 over here. You've got to really look.
To just read a little bit from Dr. Garcia's report. He says, as a board-certified plastic surgeon, I am of the opinion that subject B, that is pre-1960 Sister Lucy, and subject C and D, post-1960 Sister Lucy, share some similarities, but I am very confident they are not the same individual. The strongest evidence for this conclusion is the discrepancy between the chins. Subject C and D have far more prominent protrusive chins when compared to the profile view of subject B. This difference cannot be explained by the aging process, nor could dental work account for the observable discrepancy. In addition, subject B, that is pre-1960 Sister Lucy, eyelids provide additional evidence that subject B is a different individual than the individual pictured in subject C and D, because an eyelid crease suddenly becomes evident in the later images, and the space between the brow and the eyelash appears to expand over time instead of diminishing. Again, this is Dr. Garcia's conclusion. As a board-certified plastic surgeon, I am of the opinion that subject B and subject C share some similarities, but I am very confident they are not the same individual. Again, the strongest evidence for this conclusion is the discrepancy between the chins. We also consulted a dentist in Brazil for an odontological report, Silvia Andrade Silva. Dr. Andrade Silva gives her qualifications as follows. I am a dentist, graduated at the University of Tanaua, Brazil, in 1995. I have specialized in periodontics since 1998 and in implant dentistry since 2008. I work clinically with implant surgeries and oral rehabilitation. And in order to improve my skills in implant prosthesis, I took an exclusive course in total prosthesis in 2008. This is some of her report.
This photograph of Sister Lucy 1 is from 1948, when she still had her teeth. As a periodontist, I can see uneven gums, extrusion of the incisors, most likely due to bone loss and periodontal disease, and crowding of the incisors. The prognosis was poor, and her dentist, Dr. Alcino Magalhaes, suggested tooth extraction and rehabilitation with dentures. What actually happened was that all her teeth were extracted and full dentures made. I noticed that Sister Lucy has a dolichofacial facial biotype, elongated oval and narrow face shape. But what strikes me is the more prominent maxilla and the more retracted mandible. This detail is best seen in the profile shots. Convex profile, prominent maxilla, and retracted mandible. In this case, when we do oral rehabilitation, we try to correct the dental discrepancy as much as possible, bringing the bite closer to normal, but the bone structure of the chin remains the same. If it is retracted, it remains retracted. That's what happened with Sister Lucy 1. The total prosthesis followed her bone structure. In 1948, Sister Lucy 1, seer of Fatima, entered contemplative religious life and seclusion in the Carmel of St. Teresa in Coimbra, Portugal. Until 1967, she made no public appearances, being a recluse in the Carmel. Sister Lucy 2. This photograph is of Sister Lucy in May 1967, when she appeared publicly on the celebration by Pope Paul VI. I have named her Sister Lucy 2. Structural changes in the faces of Sister Lucy 1 and Sister Lucy 2. It is important to note that facial structure does not change with age. For example, a person with a retracted mandibular profile will grow old with this profile, even if wearing dentures, even if they have been worn down with use. Concave profile and mandibular prognatism. If you look closely, you can see that the anterior bite is offset. The lower teeth are in front of the upper front teeth. The structural change in the face took place between 1948 and 1967, when Sister Lucy 2 appeared in public for the first time. After her aging, she maintained the same facial structure with the same prognatism and concave profile. Sister Lucy 2 was already old and had the same concave profile and mandibular prognatism. Characteristics of patients with prognatism: concave bone profile, retracted maxilla, and advanced mandible. Very old Sister Lucy 2, without her dentures and with the same prognatism profile. Conclusion. In consideration of the following question, is the individual presented as Sister Lucy in 1967 the same individual who witnessed the apparitions of Our Lady of Fatima in the year 1917? Answer. There is no doubt that these are two individuals. Based on my analysis as a specialist in the study and manufacture of dental prosthesis, I have concluded that these changes in the post-1967 individual cannot be explained by the use of dentures. The facial anatomy of the two individuals is at odds with each other. The convex facial structure, dental class 2 classification, is more evident in the pre-1967 individual. Prominent facial structure, maxilla advanced in relation to the retracted mandible. The post-1967 individual has a concave facial structure, dental class 3, a retracted maxilla, and an advanced mandible and mandibular prognatism. Full dentures are not capable of altering the anatomy of the face, especially the chin, even if teeth wear down over time.
So that's the dentist report. There's one report in which I don't have any video for, but I just want to make mention of it. We consulted Dragica Brajovic, who's a superfacial recognizer, and I wanted to mention her report and what superfacial recognition is briefly in my presentation. Before speaking about Ms. Brajevich's report for Sister Lucy Truth, I should speak first about the relatively new science of superfacial recognition. For information on this new science, I will cite an article from the British Psychology Society entitled Super Recognizers from the Lab to the World and Back Again. The text reads as follows. The recent discovery of individuals with super face processing ability has sparked considerable interest among cognitive scientists and practitioners alike. These superfacial recognizers offer clues to the underlying processes responsible for high levels of face processing ability. Superfacial recognizers are individuals who are extremely proficient at processing facial identity. In the past decade, it has become clear that people vary in their proficiency on laboratory-based tasks of facial identity processing. These tests, which typically require participants to discriminate between or recognize previously unfamiliar faces, have demonstrated that face processing ability is characterized by large individual differences, with some individuals attaining high performance. Dragica Brajevich has worked with Dr. David White in his superfacial recognition studies at the University of New South Wales in Sydney, Australia. She was identified as the best recognizer in the Commonwealth of Australia in 2017, and she is currently working as a superfacial recognizer in New Zealand. For Ms. Brajevich, we divided the pictures and videos of Sister Lucy into the periods A, which are her childhood, B, her life as an adult until 1960, C, Sister Lucy from 1967, and finally, D, Sister Lucy after 1967, all the way until 2005. I read directly from her report now. In that report, she says, based upon my extensive review, I can determine the following points set forth below. The group of unknown images depict two different women. Subject A, the child Lucy, is the same person as subject B, the adult Sister Lucy, up until 1960. Person B is a different person than subject C, the 1967 Sister Lucy. Subject B, Sister Lucy, is a different person than subject D, the post-1960 Sister Lucy. And finally, subject C, which is the 1967 Lucy, is the same person as subject D, the post-1960 Sister Lucy. So the replacements, she's saying, are the same. Again, with this report, with this person involved in this new science, an imposter is identified and only one imposter is identified. There was an imposter, but only one. Finally, what I'd like to bring up is our facial measurement account. And Sister Lucy sought to confirm some of the visual findings offered by experts, including Dr. Garcia, Lois Gibson, and the facial recognition specialists. And to be more brief, I'll play the video which sums up their findings.
This is a short overview of the facial math measurements of Lucy 1 and Lucy 2. Please go to the Sister Lucy Truth website to read the full forensic report. Key finding 1, the philtrum. Lucy 1's philtrum is longer than Lucy 2's philtrum, and therefore inconsistent with the aging process. The philtrum is the base of the nose to the edge of the top lip. The philtrum length gets longer with age, not shorter. The philtrum lengths differ substantially between Lucy 1 and Lucy 2, given that the eye width philtrum length ratio is significantly different. A smaller eye philtrum ratio in Lucy 1 compared to the larger eye philtrum ratio in Lucy 2 proves that Lucy 2 has a shorter philtrum than Lucy 1. This is an inconsistent finding, which is also totally at odds with the known aging process. Key finding 2. The nose. Lucy 1's nose is narrower than Lucy 2's nose. Nose width does not change with aging. Nose interalar width was examined by comparing the ratios of the nose to mouth and eye to nose. Nose to mouth ratios are substantially different. Lucy 1's mean ratio of 0.628 indicates a narrower nose as compared to Lucy 2's ratio of 0.745. The eyebrows. The distance between brow and eye differ. Eyebrows droop with age or, at most, stay in relatively the same position. The ratios below measure the distance from 1, the bottom of the eyebrow to the middle of the pupil, and 2, the bottom of the eyebrow to the top of the eyelash. Lucy 1's eyebrows are closer to her eyes compared to the older Lucy 2, findings at odds with the aging process. Stated differently, the older Lucy 2's eyebrows should be closer to her eye than Lucy 1. But in fact, Lucy 2's eyebrows are a greater distance away. Ratios comparing the bottom of the eyebrow to 1, the pupil, and 2, the eyelash, yield substantially smaller ratios in Lucy 2, which indicate much greater distances compared to the real Lucy 1. It is extremely unlikely that an older Lucy 2 would have a greater distance between the bottom of her brow to her pupil or eyelash. Note: the arch position of Lucy 1's left eyebrow actually makes it yield a more similar ratio to Lucy 2's left brow, meaning it is farther away from the eye. Consequently, this arch causes more yellows and even a green of the left eyebrow to eye ratios comparisons between Lucy 1 and Lucy 2. This asymmetrical arching of Lucy 1's left eyebrow is visible in many photographs but absent in Lucy 2. The distance between the bottom of the eyebrow to the eye is shorter in Lucy 1 compared to Lucy 2, which is contrary to the aging process. Mathematical measurements confirm expert opinions. The pre-1967 Sister Lucy is a different individual than Sister Lucy of 1967 to 2005.
All right, I'd like to thank you for your attention. I'd like to conclude with just a few remarks on our investigation. These 6 reports are only some of the reports that we have received from a wide range of experts and the most up-to-date facial recognition technology. 4 facial recognition reports have been received. Further, reports from dentists. We have also done linguistic analysis with various Portuguese experts who have not only given us exact translations of the videos of the post-1967 Sister Lucy, but also one expert at the University of Coimbra in Portugal was even able to identify the city where Sister Lucy 2 likely came from, and even the social and demographical class that she most likely belonged to. What we clearly see from the reports of the various experts that I have presented is that the differences between Sister Lucy 1 and Sister Lucy 2 cannot be explained by dentures or the aging process. Now that we feel confident that we have identified an imposter as posing as Sister Lucy dos Santos of Fatima, our next task is to both identify what happened to the actual Sister Lucy, who it was that replaced her. In attempting to identify the imposter, we hope to find ethnic anthropologists who could locate the two Sister Lucys within the various ethnic subgroups within the Portuguese ethnic family. Any help you could offer us in this regard, or regarding any other way of furthering our investigation, will be greatly appreciated and will help to further our search for historical truth. Thank you very much for your attention to a surprising and, I think, interesting topic. Thank you.
Dear Dr. Chojnowski, thank you for traveling to Columbus, Ohio this past week to address the Ohio State Coroners Association. I found your presentation very helpful in slowly, logically, and methodically breaking down the components of visual identification. All of us Ohio coroners and investigators do this primarily intuitively by looking at pictures, but breaking down the science of this with expert letters from world-renowned scientists will be helpful to me and many others for future use in our legal obligation to properly identify the deceased. More specifically, the photographs of Sister Lucia, the Fatima visionary, showed a clear fraud. Pre-1960 Lucia, visionary, was replaced by an imposter in 1967. The evidence you presented was completely convincing as to this point, and 100% of our coroners and coroners investigators present at the meeting, totaling well over 100, all agree that they were two different people. I hope that the proper legal authorities will investigate this because it points not only to fraud, but possibly murder. Thank you for your important work, and please keep me posted on any new information as it comes to light. Sincerely, Jeffrey S. Beery, M.D., Highland County Coroner, Hillsborough, Ohio.